Hi, this is Dr. Roy Kim. There are 5 things that I think about before you have a breast augmentation, and you should know about these things as well. One of the first things is type of implant, saline versus silicone. So saline implants have a silicone outer shell, but they're filled with saltwater saline solution. Silicone implants have the same envelope or similar envelope, and they're filled with very natural feeling silicone filler. So in general, I recommend silicone implants because they feel more natural and they look more natural compared to saline ones. And both are FDA approved. Next up is the texture of the implant, smooth versus textured implants. Smooth implants have a smooth envelope. Textured implants have a slightly rough, pebbly surface, and really they were geared towards patients who wanted to have a teardrop shaped implant and to help reduce the risk of capsular contracture. What we found is that with smooth implants, especially placed under the muscle and with more advanced surgical techniques, the risk of capsular contracture and scar tissue formation is lower. With the texture shell implants, what they found is that certain types of texture shell implants seem to have problems with a rare type of lymphatic cancer. So I don't use those. I don't recommend using those going forward, and this is why they're a lot less popular. Next up is how we put the breast implants in. So the most common incision is the breast fold incision. A little less common is around the nipple areola as well as the underarm. So the most common one is the breast fold incision. It's right on the breast. I can make a nice circular pocket for the breast implant. I can actually see everything in the pocket, which helps me as a surgeon. It's more popular because there's less risk of capsular contracture, scar tissue formation around your breast implant. The nipple or areola incision is a very common one as well. It's a little less common, and the reason why is I cannot fully eliminate the risk of bacteria getting onto your breast implant when I'm placing it through the areola incision. Both the breast fold and areola incisions are actually quite similar. They're the similar length, they're right on the breast. I'm making a circular pocket and I can see everything very well as a surgeon. However, I cannot get rid of all the bacteria in your milk ducts, and that's critical to help reduce the risk of capsular contracture. It doesn't matter how much I scrub the area surgically, it doesn't matter what antibiotic ointment I use, it doesn't matter how much antibiotic I give you through your IV, I just can't get rid of all the bacteria in your milk ducts, which is why it's a little less popular and slightly higher risk for capsular contracture. So if your heart's set on a non-breast fold incision, hey, go for it, but just be aware there's a slight increased risk of capsular contracture. The underarm incision is the least favored, and I'll tell you why. It's relatively far away from the breast. So I go in the underarm incision, I create a tunnel, and then I make a circular pocket for your breast implant. So you notice that I've created a tunnel. There's more dissection, there's a little more surgery. That tunnel will shut down and the swelling will go down, but it takes a lot longer than if I just stick to making a breast dissection pocket. So that's why that incision is a little less popular. Next up is whether we put the implants above the muscle or below the muscle. So without getting too technical, you have a pectoralis muscle, and we either want to put the implant above it or below it. Above the muscle placement is a lot less common today because there's less tissue covering your breast implant. There's only skin and breast tissue. There's no muscle covering your breast implant. We definitely use this incision if you are a really avid bodybuilder. If you're the type of person that lifts weights all the time, then yes, we tend to put it above the muscle. However, for most cases, we put it under the muscle. Under the muscle placement really means there are 3 layers of tissue above your breast implant. There's skin, there's breast tissue, and there's muscle. And we're creating a pocket to put it under the muscle. Technically, if you want to get real nerdy, it's called a dual plane because it's partially under the muscle and partially under the breast tissue, but for consumer interest, really it's underneath the muscle. And that allows more tissue coverage. It's a lot more commonly done. The most critical thing is sizing. So I think all of you know that the larger the volume, the larger the breast implant, and the larger the final result. So 200 cc's, 300 cc's, 400 cc's, 500 cc's, etc. More volume, larger breasts. However, there's a much more critical thing that I love to talk about. It's the profile, which is really the width and the thickness of your breast implant. I have to tailor the breast implant for your body, for your rib cage, your torso. I have to take some careful measurements. I have to give you a breast implant that fits the width of your breast, that's in proportion to your shoulders, ribs, rib cage, everything like that, and give you the breast implant that fits you. To make things confusing, there are actually 7 different kinds of profiles within just one company. The other company has multiples as well. The easiest way of thinking about it is if you have coffee and you want a thin medium, or thick coffee. If you want a small, medium, or large coffee, well, the cup sizes are going to be bigger, bigger, bigger. With breast implants, that's a little too easy. They can't call these implant profiles thin, thin plus, medium, medium plus, thick, thick plus. They have to use confusing terms such as moderate classic, moderate profile, moderate plus extra profile, ultra high profile, etc. But if you really just stick to small, medium, large, thin, medium, thick, and go from there, that should help you with the profile. Obviously, if you get the thickest profile available, it's going to give you a lot more cleavage. It also may tend to look a little artificial, which is why most patients don't get it. Likewise, the thinnest implants that they make, again, volume, you look good, but it may not be quite the look you want, not that much cleavage, not that much volume. Most patients choose to get something in the middle, and most patients are candidates for that. The profile is so critical because it is completely dependent on your body. I can get 100 women, your height and weight, but the rib cages are going to be different. The amount of breast tissue you start off with is going to be different. And even to end up with the same or similar results at the end, the implants are going to vary in volume as well as profile. If you think about it, if you as a patient gain 10 pounds or lose 10 pounds, it's really not going to change your rib cage and the width of your breast at all. So this is why it's not dependent necessarily on your height or weight. It depends on what I'm visualizing and seeing in consultation with you in the office with careful measurements. And then we have to figure out together what volume and profile is best for you to get the most beautiful long-term results. Thanks so much for watching my video. If you have any questions, please leave it in the comments below or send it to our office. And I look forward to more and more videos and interacting with you. If you have any questions or suggestions about future videos, please let us know. Thanks.